Pelvic floor is a muscular diaphragm which is present at the lower aspect of the pelvis. There are a number of problems, pathologies that affect the pelvic floor, leading on to significant symptoms in the general population. It is more so seen in the female population given the wide pelvis, given the labor or the deliveries females go through. The problems that are faced both by the female population as well as the male population relevant to the pelvic floor include difficulty in evacuating, where one can feel the presence of stool but are unable to expel it. We call this spectrum of symptoms as obstructive defecation syndromes. These problems impact on one's quality of life significantly and need attention. In addition to that, patients can be troubled with bloating as a result of inability to evacuate the stools, abdominal discomfort, lack of appetite, as well as feeling low as a consequence of these symptoms. On the other spectrum of pelvic floor problems is the fecal incontinence, where there is lack of control over passage of wind or leakage of liquid stools, either passively without being aware of it or actively being aware of it. Urgency to rush to the toilet, leakage, soiling, these are all part of the problems related to the pelvic floor. These can be as a consequence of either a traumatic delivery such as an episiotomy, a forceps delivery, or a prolonged labor, or previous operations that have been undertaken on the back passage, which would include a sphincterotomy, a hemorrhoidectomy, or any other procedure on the anal canal. When such is the case that is affecting the pelvic floor, they need thorough examination as well as investigations. Investigations undertaken could include an endoanal ultrasound, an MR proctogram to check at what's going on in a dynamic fashion, anorectal physiology, followed by a multidisciplinary team approach to identify and diagnose the condition. More often than not, majority of the pelvic floor problems are dealt in a conservative way, wherein our aim is to manage the condition and improve the quality of life rather than treating it. Surgery essentially takes only a minor role in a very small minority of the population when it comes to pelvic floor disorders. What really helps is a multimodal management dealing with the diet, dealing with toiletry habits, dealing with the positioning of using a toilet, wherein the Indian system of toilets where one has to squat helps the mother nature, helps the physiology, helps the anatomy of the body to expel the stool easily. In addition to that, some drugs and medications can be of some use, either high fiber and fluids when there is significant constipation, or reduction of fiber and fluids if there is significant amount of diarrhea leading on to these things. Pelvic floor exercises and biofeedback also take a significant role in the management of pelvic floor disorders. Surgery is certainly the last option, and if there is a need for an operation for pelvic floor pathologies, we can either do the procedures perineally if there is significant prolapse happening as a consequence of pelvic floor problems, or abdominally using an open or a keyhole approach. It is very important to attend to pelvic floor pathologies given the impact on the quality of life one would suffer because of these problems. Thank you very much.